Acoustic neuromas are usually benign, slow-growing tumors. The most common presentations are hearing loss, tinnitus, and balance problems. Usually patients present to their GP or ENT surgeon or neurologist with unilateral hearing loss, sometimes associated by tinnitus, sometimes by dizziness or balance problems. It is rare to have larger tumors that present with symptoms of raised intracranial pressure or other neurological deficits. Nowadays, it is also quite common to find acoustic neuromas as incidental findings on routine scans for prevention or for any other reasons, such as head injury. In summary, though, a patient who presents with new onset, what we call sensorineural hearing loss, needs an MRI scan. Acoustic neuroma are usually diagnosed with imaging modalities such as MRI or CT. The gold standard is an MRI scan of the brain, usually with some contrast medium called gadolinium, and it's usually a sequence called MRI internal auditory meatus. Other tests that are necessary in assessment for acoustic neuromas are audiology assessments, which often involve a hearing test and a speech discrimination test. But in summary, the main test that is required is an MRI scan of the brain. There are several treatment options nowadays for acoustic neuromas. Some of them are diagnosed when they are small or incidental findings, in which case what we call watchful wait with interval surveillance scans is a very valid management option. For larger tumors or growing tumors or symptomatic tumors, then active treatment starts becoming indicated, and active treatment can involve either surgery or a form of stereotactic radiosurgery such as gamma knife. In regards to surgery, there are several different approaches, such as the retrosigmoid, the translabyrinthine, or the middle fossa approach. We tend to discuss all management options with patients and decide on an individually tailored basis, based on the individual anatomy, patient preference, presentation, and the scans. The following treatment, patients might go through a period of worsening balance or hearing problems. Balance problems can sometimes be temporary and can improve with vestibular physiotherapy or with time. It is a bit more complex with hearing loss or hearing problems, as some of these patients present with hearing loss already, which is irreversible. The actual treatment has a risk to hearing, but also the natural history of the disease has a risk to hearing. So this is difficult to predict in a one-size-fits-all fashion. It's rather an individual scenario. If patients have surgery, the recovery period is obviously longer than other modalities such as gamma knife. But the take-home message is that acoustic neuromas are usually benign, slow-growing, and treatable tumors, and it's perfectly achievable to achieve in the majority of patients very good outcomes in the long term.